Back, everyone. We're going to jump into our nutrition break, sponsored by Dr. Scher on IBS and the low FODMAP diet. Meghan Donnelly is a registered licensed dietitian living in New York City. She has a bachelor's degree in biology and a master's degree in nutrition and dietetics. Her clinical training in dietetics took place at the James J. Peters Veterans Affairs Medical Center in the Bronx, New York. She's currently the senior manager of nutrition services at Dr. Scher USA. Meghan feels passionately about the role of digestive health for chronic disease management and overall wellness, and specializes in celiac disease, gluten intolerance, irritable bowel syndrome, and chronic kidney disease. Welcome back, Meghan.
Thank you. Nice to be here. All right. So let me just... Mark, I think you have to give me the access to share.
All right, our host should be able to switch that over.
Oh, here we go. Yep.
Okay.
Okay.
All right, we see it.
All right. Hello, everyone. So today I'm going to be talking about the low FODMAP diet for irritable bowel syndrome and how it's related to celiac disease. So I guess the first question here is, how are celiac disease and irritable bowel syndrome related? And first of all, the symptoms are very similar. They're very commonly diarrhea, constipation, abdominal pain, GI type symptoms that many people with celiac disease experience. But also, between 5 and 15% of people with celiac disease were originally diagnosed, correctly or not, with IBS. And the prevalence of celiac disease in people with IBS is 4 times greater than that in the general population. So these statistics really highlight the fact that not only are both celiac disease and IBS very common, but it's important to know the similarities and differences between the two if you want to have a truly accurate diagnosis. So what is irritable bowel syndrome? It's really a disorder that affects the intestines and involves problems with motility, which is movement of digested food through the intestines, and also sensitivity, which is how the brain interprets signals from the brain and the intestinal nerves. So this can lead to abdominal pain or changes in bowel patterns and other symptoms. So per the Rome 4 diagnostic criteria for IBS, there are 3 different types: IBS D, C, and M. And D means that symptoms are diarrhea predominant more than 25% of the time. C means that symptoms are constipation related more than 25% of the time. And mixed kind of means a little bit of both. It's a little tougher, but these people typically experience both types, diarrhea and constipation. And we define diarrhea and constipation typically using this Bristol stool chart. And I'll often tell people, to circle the one that most applies to them, and then we can determine whether or not they have diarrhea or constipation type symptoms. So IBS is really common worldwide, and it affects about 11% of the population globally, but Canada has a higher prevalence than the rest of the world, affecting about 18% of the Canadian population. The actual trigger for IBS is somewhat unknown, but many people report onset during some traumatic event or infection, but sometimes it can be pretty random. And the symptoms are related to a disturbance in gut motility and sensitivity, which again causes abdominal pain and gut microbiome changes. Pretty significant symptoms associated with IBS. We're going to cover some of them in a minute, but they have a dramatic impact on quality of life. So in this study, which is these statistics are from the Canadian Digestive Health Foundation, but 70% of IBS patients say that symptoms interfere with their everyday life. 46 reported missing school or work due to their IBS symptoms. 40 to 60% experience psychological symptoms because of their IBS-related problems. And then patients were reporting they would give up years of their life for an immediate cure, in addition to a high economic burden costing more than $2,000 annually per person just for management of the condition. So the quality of life issues are very severe, and there's a lot of research going into this right now. But in general, some other coping mechanisms for people with IBS, people avoid social activities using communal bathrooms. Sometimes they have to plan their whole day and their trips and their schedules all around when they expect their symptoms to be worse. Some people reported that, they had to take pain medications and bring spare underwear with them. So the symptoms can be pretty significant and definitely are one of the big drivers as to why we are looking for dietary interventions in IBS. So here's an overview of some of the symptoms of IBS. Like I mentioned, they're pretty common to some of the symptoms associated with celiac disease. But basically, these are all things we associate with having an upset stomach. And in IBS, these tend to be more severe and they can last for weeks, months, or years at a time. Because these symptoms vary so much, though, there are no, and also keeping in mind there are no IBS-related biomarkers, the diagnosis can, of course, be challenging, as it is in a lot of these GI conditions. On average, IBS diagnosis takes about 4 years and involves a lot of testing, trial and error, and treatment options. But eventually 60 to 80% of people diagnosed with IBS say that food triggers their symptoms. And this is, again, it's not true in everyone. And the types of foods are different from person to person, but it's typically somewhat related to food. So when we talk about treatment, there's a lot of ways to treat IBS symptoms. Diet is one, that's of course the one we're going to focus on today, but there's a lot of other options. So typical management might involve a combination of a few of these things. And many people find, if they manage their stress well, make a few dietary adjustments, they can avoid a lot of the symptoms. But it's important to note there's no cure for IBS. All these treatments are palliative and aimed at avoiding or treating symptoms. So why do we care about food in IBS patients? Well, ingestion of food triggers symptoms in more than 60% of patients. And in addition to that, dietary treatment with a low FODMAP diet, which is one of the treatment options that I am going to go through today, improves symptoms in about 75% of patients. So the low FODMAP diet is a phased approach, and we'll go through it pretty carefully, but that is the reason that we focus on food in management of IBS. And then most importantly, the quality of life issues in IBS are important to address, because if dietary modifications improve symptoms in so many IBS people, we can help them avoid painful, embarrassing, and unpredictable symptoms, empower them to partake in social activities, and help them reduce stress and anxiety associated with social activities and dining out. So here's an overview of what dietary treatment in IBS looks like in an ideal setting. So first, the diagnosis would be made by a physician, typically a gastroenterologist. From there, the gastroenterologist would refer the patient to an experienced dietitian, and the dietitian will make a diet history, examine the patient's eating patterns, and trial a FODMAP diet approach. And if the dietary modifications are unsuccessful, we might have to try something else. You might have to refer out to a different type of specialist. Sometimes it's a GI psychologist, sometimes it's an acupuncturist. It can really vary, but dietary intervention is often one of the first things tried. All right, so I've been talking about FODMAPs as the main diet approach for IBS treatment, but what actually are they? So this crazy word is an acronym that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And these are just basically carbohydrates that are found in different foods, and they are poorly absorbed in the gut. So in some sort of malabsorption of FODMAPs is normal. So these tend to be poorly absorbed in all people, but in people with IBS, the potential of these carbohydrates causes discomfort because they are hypersensitive to them. So as you can see here, FODMAPs draw water into the small intestine, which can cause bloating and distension. And then they also draw gas into the large intestine, causing gas. And so the excess water and gas can cause this greater distension, which pushes up against the nerves in the abdominal wall and can cause pain. And so in healthy people, FODMAPs move through the bowel without much consequence, but in people with IBS, the malabsorption of these carbohydrates can cause severe reactions and diarrhea and constipation, bloating, gas, abdominal pain, and discomfort. So the symptoms that occur in people with IBS might be explained by a number of factors. I mean, it could be related to gut hypersensitivity to the gas production, higher production of gas, or bacterial overgrowth in the small intestine. So all of these are things that are contributing to the unpleasant symptoms. So FODMAPs are found in a lot of different foods. As you can see on this list, many of these foods are very healthy foods that, of course, we want to include in the diet. There's 4 basic categories which are represented in these various charts. As a dietitian, obviously showing a patient like this can be very overwhelming, which is why it's important that a patient implements this program with a dietitian. Just would like to clear things up a little bit. So I want to point out patients do not need to eliminate every single food on this list, and they don't necessarily need to follow the diet forever. So I'm going to speak about how to implement the diet, but keep in mind, not every food on this list is out for every single patient. All right, so this is the FODMAP diet approach is a 3-phased approach, actually. So they're all represented here. So it's important that the patient move through each of the phases because the goal of the diet is to treat symptoms and heal the gut, not lead to over-restriction and food avoidance forever. So in phase 1, patients are in the elimination phase where we eliminate all high FODMAP foods as on the previous list for 2 to 6 weeks. The key piece here is to teach people how to swap high FODMAP foods for low FODMAP alternatives. And there are tons of those. So as a dietitian, I always like to give people a list of foods you can have in addition to a list of foods you can't, because that's, I think, the only way sometimes you can really process what it is that is, quote, safe. So then in phase 2, we reintroduce the FODMAPs systematically. So we'll introduce a small serving of a food and then increase the portion size over the course of a few days. There are no symptoms, you can move on to another category of foods. But really the goal of this phase is to identify which foods and triggers cause symptoms in the individual patient. So I'll tell you some of the more common ones are lactose and dairy, fructans and wheat-containing products, and garlic and onions. So those are the most common, but of course, there are some people who are intolerant to very random things on that list. And so that's really why we go through the reintroduction phase so slowly over the course of 6 to 8 weeks. In phase 3, the patient and dietitian assess the results of the reintroduction trials and come up with a plan for maintenance. You can't necessarily prevent flare-ups forever, but avoiding trigger foods generally can help prevent symptoms. I do want to point out there's some contraindications to this plan. So people with active eating disorders, this plan is not appropriate because it's restrictive in nature. In children and people with signs of malnutrition, we tend to do a less restrictive FODMAP gentle approach, which just eliminates some of the foods and some of the more common ones. So it's, again, really important to work with a dietitian because the implementation of this diet is complicated and needs to take into account the person's age, mental state, lifestyle, ability to follow the diet. And there's no one size fits all approach for these types of things. So it's really important that you're working with someone who knows what they're doing. I'm just showing this list again because I think there's a critical piece here that explains why, we're involved in this and we're talking about it here today with the Canadian Celiac Association. But, wheat, barley, and rye are high FODMAP foods. And of course, those are the gluten-containing grains. And so many of the dietary restrictions are similar. So, for example, a person with IBS might not have to worry about cross-contamination like someone with celiac disease would, but they still have to avoid wheat, barley, and rye and may report, quote, feeling better on a gluten-free diet. So a lot of people who have gluten intolerance actually, might have an IBS type presentation. There's some debate in the GI world if it's celiac disease or IBS causing that symptom, but wheat, barley, and rye are high in FODMAP. So very often the diets look similar when it comes to the personalization phase. So as a reminder for those of you who don't know, gluten is a protein that's found in wheat, barley, and rye. And of course, the gluten-free diet is the only treatment for people with celiac disease. So these grains must be eliminated. But again, wheat, barley, and rye are high in fructans, which is a FODMAP category. So gluten and FODMAPs often present together in foods. And so by going gluten-free, you might see improvement in your symptoms and that's probably because you're reducing your intake of FODMAPs. So just kind of re-summarizing what I said. All right, and so I also want to point out that many people with IBS tend to tolerate sourdough breads better than regular breads, and this is because the yeast in sourdough degrade the fructans during fermentation. So this can depend on the flour used, the fermentation time, and microorganisms used, but this is a nice solution for people with IBS. So just an FYI, sourdough does not always have to be a wheat sourdough. We use a sourdough starter in many of our breads at Char, and that's because it tastes great, it's easier to digest, and it helps preserve the breads a little bit longer. So this does not have to be a wheat sourdough. It can just be a sourdough starter using a gluten-free flour. All right, so moving on to the FODMAP testing and certification, and maybe giving you some context as to why I'm talking about this as a gluten-free company representative. But to give you some background, Monash University in Australia has really spearheaded low FODMAP diet research, and they're the ones who have identified the FODMAPs, created the diet, tested foods. And so recently, in the last 3 years or so, we started to work with them on certifying many of our products as low FODMAPs. So we work with them directly because they're truly the IBS experts. And this logo you see here is something you might start to see on Char packages, and it's the Monash University Low FODMAP certification. So all manufacturers who want to test their foods have to send their products to a specialized lab who tests the food. They go through 3 rounds of testing, and they cannot contain any FODMAP containing ingredients, or they have to be at levels low enough to still be considered low FODMAP. So the chart here shows you the cutoff values, which isn't super important, but it's published data. You can find it on their website, and it's been also validated in peer-reviewed articles in the scientific literature. So once a product gets tested, they're given a red, yellow, or green light for each category listed. And if they meet the criteria to be considered low FODMAP, you can put the logo on pack. So this is something newer that you're probably going to start seeing, and it's on some of the Char products as well. So the benefits of this certification, I mean, I think given the large prevalence of IBS in general, it's very important to kind of have this, but also it helps guide people who might be having other uncomfortable GI symptoms. And so finding low FODMAP foods, I mean, you saw that list. It can be confusing, stressful, and time consuming, sometimes even more so than looking for a gluten-free label, because this is such an uncommon label. So the certification really does make food shopping easier, saves time, and alleviates stress. So I think this is I think you'll start seeing it on a lot more products given the prevalence of IBS and the prevalence of people who also have some sort of unexplained GI condition that, they quote, feel better when they go gluten-free. I think this happens a lot, and it's probably more so related to the FODMAPs, unless, of course, they have true diagnosed celiac disease. So these are our low FODMAP products in Canada. As you'll see, we have a good number, and this list is always growing. So again, all of our breads are made with a sourdough starter. They're all high in fiber, and a lot of them, like our multigrain ciabatta and our multigrain crackers, are made with things like quinoa, buckwheat, and flaxseed. So some really good, nutritious, gluten-free grains that taste great also. And you'll see, yeah, the little low FODMAP logo here right on the front. All right, and I just wanted to show you this app. So Monash University has a very helpful app for people who are following a low FODMAP diet for IBS. This database has hundreds of tested foods, including fruits, vegetables, whole grains, dairy products, certified foods by country. And so there's a whole list of things in there that, whatever you can think of, basically, it's in the app. There's also some recipes and meal and snack ideas, but what I really love about this app is this feature here in the middle. So it tells you where to find a food, but then it also tells you which FODMAP the food is high in, which is helpful if you know what your trigger category is. So, for example, if you know that fructans are not an issue for you, but it's high in mannitol, you can still probably have that food because you know what your trigger categories are. So this is really helpful for dietitians and helping teach patients how to take this diet and apply it in their daily life in a way that really makes sense. And again, I shared this slide yesterday, but we have a lot of resources on the SHAR website if you want to learn more about this. IBS is definitely pretty complicated, and it's, of course, something that you want to work through with a dietitian, but it's also, there's some conflicting messages online and some maybe questions about what's actually necessary for restriction. So we have really good resources online, and happy to check them out on www.shar.ca. All right, that's it for my slides. If anyone has questions, I'm happy to take some.
Thanks very much, Megan. Yeah, there definitely are questions. Lots very relevant, even for those of us who are doing okay on the gluten-free diet. We understand the critical importance of labeling, so it's good to be seeing low FODMAP products bearing labels now, making shopping easier for many people. So question, so this was more Canada specific, but we can broaden it to be North America. Do you think that there's is there the lower rate of celiac diagnosis over here compared to Europe? Some places in Europe, difference in healthcare systems, of course. Do you think like there might be a higher IBS in Canada, apparent IBS due to lower celiac diagnosis?
I don't know that they're necessarily like more educated in at diagnosing IBS than celiac disease. I just think that it seems like with IBS, there is like a genetic factor, and so it tends to affect people more in European people who are of European descent more so. As far as, celiac diagnosis, it does vary from country to country, and some countries are really strong in it. But Canada, to my knowledge, is pretty good. So I think, there's always work we can do to improve diagnosis, but I don't think it's that they're better at IBS than celiac disease. I think it's just, it's probably just that the global prevalence of celiac disease is pretty consistent, and there's something going on, environment or whatever in Canada, that makes it a little higher.
How exactly is it diagnosed?
So there's no biomarker. So there's the symptomology criteria, which basically, I think I showed it in one of the earlier slides. I can go back to it, but it's basically just, they have to look at your GI symptoms over about 6 months, and they'll do that based on how often you're experiencing whether it's diarrhea or constipation, and what types of symptoms you'll have associated with it. So typically the defining one is like you'll have abdominal pain associated with your diarrhea or constipation, but you can look up the Rome 4 criteria online and they'll outline it exactly.
And I know this varies wildly for celiacs, but for IBS, do you know roughly how quickly the symptoms appear after eating a food that triggers them, and how long do they last?
It very much varies. Most people that I work with, though, have symptoms a couple of hours after eating that food, and usually they tend to get worse over the course of the day, because FODMAPs are what we call dose dependent. So kind of like the lactose intolerance talk yesterday, sometimes you can tolerate a little bit, but once you reach that limit, that's when you have symptoms. So a lot of people, they feel okay, and then oftentimes later in the day, they start to experience symptoms. And so it really does depend, though.
And when someone does eat, like for FODMAPs, is there a digestive enzyme that is designed like lactate for FODMAPs kind of thing?
There are digestive, there are digestive enzymes that can target specific types of carbohydrates that there's one called, I forget the name of it right now, but there are a few. And the thing I always say with digestive enzymes is you have to make sure that you're getting the one that's for the FODMAP that you're intolerant to. And so you always want to make sure you're looking with a professional who knows what they're doing, who knows that that enzyme is going to help you. So yeah, there are some, there's a lot of good brands out there. It's just kind of, you got to make sure you're getting the right one.
And for vegetarians, any recommendations on like how they might best follow a diet that's lower in FODMAPs, and also any comments on where they can get good protein sources that are gluten-free?
Mm-hmm. Yeah, so all of the animal proteins are going to be low FODMAP, which which I understand this person's asking about vegetarian sources specifically. So a lot of things like quinoa is usually okay. Things like hemp seeds are usually okay. The different whole grains, all the gluten-free whole grains, that's kind of how I would say you can get some protein in. You know, it is a little harder, certainly, if you're a vegetarian, but you know, I would say look at the resources on the Monash app and the Monash website. You'll find all kinds of good articles on how to be a vegetarian and follow a diet like this. Because like the biggest thing is you have to cut out beans and legumes for low FODMAP diet. But again, that may not be your trigger. So it's probably going to be something that you can tolerate in a small amount or add back or something. So yeah.
Sounds like it involves a lot of trial and error. I know when I've had people saying, I think I'm going to go on the low FODMAP diet, and like, well, no, you should talk to a dietitian first. That's a pretty complicated diet. So like, would you agree that like people should probably undertake this diet with the supervision of a dietitian? Like you talked about the phases and all that.
Yeah, absolutely. This diet, I mean, because of the list of foods that you have to cut out, I think, like I said, it can be hard to remember what foods you can have. So there's always, I think, a risk of not getting enough of the nutrients that you need because of following such a strict elimination diet. So you should always work with a dietitian because they are the ones who are going to make sure your diet's nutritionally adequate. And of course, you know, we don't want to cause more problems like malnutrition and nutrient deficiencies because of an elimination diet to fix your GI symptoms. I mean, those things are contraindicated with each other. So
yeah, definitely want to look before you leap.
Yeah, absolutely.
For non-food triggers, someone mentioned about how their IBS could be triggered with fragrance exposure, and asking about have you heard of that? And is there like potential sprays on foods or GMO? Could any of these be factors?
So that's it kind of depends. So those things can definitely cause digestive symptoms if you're sensitive to them, but that's not necessarily IBS. And so I think I had some of the non-food triggers on here, but the IBS triggers, I mean, stress, whatever, those are all here. Yeah, here they are. Those are all definite triggers. I think that, you know, typically I would refer someone who has a non-food trigger, I would refer them to some of these alternative treatment options instead of a dietary intervention. So things like stress management or gut-directed hypnotherapy or certain types of exercise, all of these things would be my thought if something like that triggers your symptoms. But as far as like food chemicals and preservatives, that might just be a true sensitivity to those things. And of course, the goal, you know, eliminate those things from your diet. That's still the case, but you wouldn't need to do a low FODMAP protocol.
Okay, and in foods, are the FODMAPs that are offending people in foods less effective when it's cooked versus raw?
No, there's not a lot of data on that, but pretty much no. Sometimes when you cook things and puree them, you change the type of fiber. So sometimes people tolerate raw versus cooked better, but that's not about the FODMAPs necessarily. That's more about the texture of the fiber.
Okay. Have you heard of blue colored muffins to diagnose IBS? Someone brought this up.
I have not, no.
Okay, it lacked context, but it caught my eye with the question. Someone talked about hickory root inulin cases causing a lot of bloating. Could those things be high FODMAP as well?
Yeah, so those are prebiotic fibers that can definitely be a problem with IBS. And so my recommendation would be to either go to the Monash app or the Monash website to learn more, because those things definitely can cause a problem for people. Yeah.
Okay, and just about at time, but I might finish taking advantage of you being with Dr. Scher, ask some product-specific questions that people had. Are you looking at making anything that's soy or tree nut free? Someone's asking about, like, they have multiple allergies in the house. It's tough to find things that everyone can eat. So
we do have a few products that are tree nut free, and those are indicated on our website. So you'll see that. If, you know, basically for us, we take allergen management really, really seriously. So if you see a may contains tree nuts, that just means tree nuts are in the facility. And so we don't want anyone to have a reaction. So we always call it out. If it doesn't have that logo on or that label on the allergen statement, then there's no tree nuts in that facility. As far as soy, this is a question we get asked all the time. we're working on trying to get some of our products soy-free. These things take a long time, and we want to make sure that we're not exposing anyone inadvertently. So soy-free, there's a few products. I don't know which ones off the top of my head, but there's only a handful at the moment. And when we get soy-free certification, we will blast it everywhere, so you will know.
And the cornstarch in your products, someone asked about whether the corn is GMO free.
So our products are non-GMO. They're, just because of European sourcing, a lot of times that's why.
And finally, do you know if the any gluten-free phyllo sheets are coming to Canada anytime soon?
Oh, I don't. It's funny. That's one of we get asked that question all the time. So to my knowledge, I don't have that in my knowledge base, I guess. But one thing we are launching in Canada in January is our pizza crust, which is really exciting. That's one of my favorite products. So that'll be coming to you guys in the winter.
I have used that as well. I think I bought it when I was in Europe once. So yeah, definitely recommend that and look forward to seeing it in Canada. All right, well, thank you very much, Meghan, for joining us again today. I really appreciate you bringing your expertise to us.
Yeah, of course. It was great to be here.
And before